let's say somebody comes in for sciatica pain, we can treat that pain, which would be considered more a branch idea, meaning more symptom, as opposed to the root cause. What's the root cause, right? So we'll look at it all. What's going on mentally, what's going on internally, what's going on symptomatically. And I think that sometimes gets lost in the biomedical world.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode. Thanks for listening in to The Exploding Human. I'm Bob Nickman. That was Sheri Jennings at the top of the show, and we are going to be talking about acupuncture and oriental medicine, and even more than that. So stay tuned for that. First, I want to invite you to visit my website, theexplodinghuman.com. That's TheExplodinghuman.com. On that website, you can listen to all of my episodes, see photos of all my guests, synopses of the shows, a little bio on myself, and there is a donate button if you'd like to support the show. That would be great. Thank you. And also, I'm encouraging you to subscribe for free to my YouTube channel, which is The Exploding Human with Bob Nickman. Add the with Bob Nickman to subscribe to that. My show today is sponsored by Hero Soap Company. That's Hero, soapcompany.com. They make the best healthy soaps infused with essential oils. They smell unbelievable. They last a really long time, and you feel very fresh and clean, and I use them. I actually use them. And part of their profits goes to helping homeless veterans. So you're not only getting great soap, you are helping homeless veterans. And at checkout, if you type in the word exploding, you will get a discount. My friend Lucas over there has offered a discount to the people that listen to this show. So my guest today is Sheri Jennings. Sheri is an acupuncturist and has studied oriental medicine, but we're going to talk about even more than that. We're going to talk about functional medicine. We're going to talk about herbs. We're going to talk about food, diet, stress, all this stuff that, we can do to make our lives healthier, and how she goes about that in her practice. And she explains it a lot better than me because she's the guest. So please listen in. This is Sheri Jennings. Good morning, Sheri. How are you?
Good morning. I'm fine, thank you.
We have a lot to talk about because I know that you are a doctor in resident at the Yosan Clinic in Santa Monica for Oriental Medicine. I used to go there as a patient many years ago because I had a friend that was studying there. So I've had a lot of acupuncture. I've had cupping. Mm-hmm. I don't know if you do that.
I do.
What's the stuff that they burn? What's that called?
It's called moxa.
Moxa. Yeah. I love that smell.
Yeah.
We'll talk about that. And I've done some herbs. So I'm not unfamiliar with what you do. I am fairly unfamiliar with, you also do CBD you have a company. What's the name of the company again?
My company is Original Herb Farm. I started about 3 years ago.
Let's start with that, actually, because I haven't really had somebody that does that on. So talk to me about CBD and how you use it and how it has helped people and what it works on.
It can really be used for so many different issues. So whether it's some kind of emotional, mental issue versus some kind of physical pain, the route in which you take it absolutely matters, because we've got something called bioavailability, the ability for a substance to get into your bloodstream and your ability as a human being, right, to absorb whatever that is that you're putting into your bloodstream, in this case, CBD. You can smoke CBD, you can take it as an oil, you can put it on topically. Remember, like, topically is a whole other idea because our skin has a certain permeability. And so part of the reason medicines topically, they say on the instructions to put on liberally, it's because you have to put on quite a bit in a wide surface for it to actually penetrate the skin and actually work. Tinctures you take under the tongue. You have sublingual glands under your tongue. So you take however much is prescribed, and you drop it under your tongue and you literally let it dissolve into your glands. That's a direct route to your bloodstream. So the bioavailability will go up, as opposed to eating a gummy, a CBD gummy, which you would take, and that would go through your digestion, your liver would process it, and you wouldn't have as much bioavailability.
And then you have to figure out, depending on what the patient is complaining about or discussing, which form to administer. What's the best way to do that? Let's say somebody is suffering from anxiety. Let's just pick anxiety because there's a lot of it going on, a lot of stress, a lot of anxiety.
Good one. It's a
and I'm sure you get a lot of that. People go, I am so stressed. I'm so anxious. I'm so, how would you, what would you prescribe for something like that? Obviously, it's not one size fits all. I get that.
And you're right, it's not. And there's no specific chart, like a pharmaceutical chart, where you would be like, okay, you take this many milligrams of ibuprofen and, that kind of idea. It's really tailored to the specific individual. But essentially, where I would start is maybe an average kind of strength of CBD, maybe 400 to 500 milligrams in a 1 ounce bottle, milligrams of CBD. The rest of that ounce would be carrier oil.
And what type of oil is it carried in?
So typically, people use what's called MCT, which is a fancy way of saying refined coconut oil. That stands for medium chain triglyceride. The reason that's important is because CBD is fat soluble, so it needs fat to work, and that's about 80% saturated fat, so it helps it work.
Okay.
So people with a little more meat on their bones might need less CBD versus people who are a bit thinner. Depending on the type of anxiety that you might have, because it comes in all different forms, right? There's anxiety that's debilitating. There's anxiety that stops your focus. There's anxiety that makes you not be able to sleep. So then I would turn to different terpenes to help with that. There, as you mentioned, terpenes are kind of the flavor profile, but they're more than that. If you think about a volatile oil, like let's say peppermint oil, what gives it that pepperminty smell and flavor? That's a terpene. And they're very fragile. So plants have hundreds of terpenes in them. And one is called linalool. So
linalool.
Linalool. Linalool, I think is how it's spelled. Close to that.
Okay. All right.
So linalool has almost a lavender profile to it. And lavender, as many people already know, is very calming. So if I were to add linalool to the oil, it could give you even a more calming effect and also help with sleep.
And I'm assuming that you, and maybe I shouldn't, that you combined some of your disciplines together in a treatment. So if somebody were to come in with, we'll just stay with anxiety, there's an acupuncture approach to that, and there's an herbal approach, and then there's a CBD approach.
Yes, Absolutely. And I mean, there are some basic acupuncture prescriptions that you can start with somebody who's experiencing stress um and like I said, like stress, anxiety, right? There's different kinds. There's the person who, looks like they're about to blow their top, and then there's the person who can't get out of bed. So the acupuncture prescription would need to be either what we'd call for excess, an excess person, or a deficiency person. With somebody who, let's say, can't get out of bed, you're going to give them a bit more of a boost, and you're going to nourish them, or what we call tonify them a little bit, to give them maybe more movement of energy. Whereas a person who's like got this stress and they're like on their last straw. So then we would do something called sedating techniques. Because if you think about what acupuncture is, right, we have what we call 12 primary meridians. We also call them channels. You could think about them as almost like freeways going up and down from head to toe. And when these freeways get blocked in a traffic jam, what does that do to you? It makes you angry or upset or frustrated, or whatever the emotion is, can cause stagnation or an obstruction, a blockage. That's the traffic jam, a blockage. So same thing in your body, these 12 primary channels that run up and down your body, they get stuck. Maybe because of the food you ate, maybe the stress, the anxiety, the lack of sleep. And so the idea is to unblock that obstruction so that your energy can flow free, creating more of a homeostasis, a nice balance in your body, as opposed to an imbalance. And that's also what yin, and how we pronounce it here in the Western world is yang, but in the proper way is actually yang. So yin and yang need to be in perfect balance, which is hard to do because they're never in perfect balance.
Let's say there's a blocked channel and you unblock it with acupuncture or whatever treatment. Where does that energy, that stagnant energy, what happens? Does it come out in emotions? Does it come out in just feeling great because it's because it's concentrated something?
Yeah, right. No, that's.
And so is there, do people, I'm sure there's a lot of different responses. I never had like, when I had treatments, I never like cried or anything like that. But I would think that could happen in some situations. I usually just got up and felt very relaxed or energized and clear. Those were my sort of responses to acupuncture. I went not for that, though. I mean, I went for specific areas of pain that I was dealing with. But that feels like blocked energy also to me in a lot of cases, like stress caused physical pain.
Absolutely. Yeah. Pain is the same concept. So pain can be derived from any number of issues, trauma or old injuries or emotions, etc. So to answer your question about where does the energy go,
Yeah.
I think that's your question, right? So
it is.
In acupuncture and traditional Chinese medicine is called qi, spelled Qi, and that's literally energy in your body. And how do you get energy in your body in the first place? You get it through food and air for the most part. That's how we think about it, food and air. You're also born with a certain amount of energy, and we would relate to that. We would call it essence. You were gifted at conception, basically. And then you replenish that with food and air. And that mixes together to give you energy. So when it's all blocked, we're literally moving it in your body. So it's not that it necessarily, it does go somewhere, but it's not quite like that. It's more like it moves along the channels and it'll continually replenish itself. It also moves into the organs. Every organ in your body has energy to function. So again, if that qi is blocked, let's say in your lungs, you might have difficulty breathing.
I've had some interesting body work done over the years where I had pain in, let's say, my shoulder, and the practitioner would rub a certain spot and then go down some kind of a muscle or meridian or whatever you want to call it and rub a second spot, and they would hurt.
Yeah.
And then I would get up from the table and the pain would be gone. And I was like, what did you just do? It was so odd to me because I had never experienced that before. It's like, these aches and pains, some of them were just, it what appeared to me to be blocked energy. That's what it felt like. And it got unblocked by hitting these two acupressure points, I guess you would call it.
Yeah, that's exactly right. Acupressure is amazing. There's so many tools besides acupuncture in somebody who is labeled an acupuncturist. As you mentioned, like moxa is the same concept. It's very warming. So if somebody came in and they were blocked or they had an obstruction because of some kind of coldness inside their body, because if you think about what cold does, it constricts. When something gets tighter or constricts, it can cause pain. So moxa we can use to warm up the channels. So there's so many different types of moxa. I don't know what kind you might have had. Probably what we call just like the pecking moxa, where they take this big stick and kind of wave it around.
It was like a big, thick clump of
yeah.
I guess what is it? An herb of some
It's
kind, a plant of some.
Yeah, it is. Okay, so that's a little bit different. It was probably Aya, which is pinyin. It's spelled Aiye, Aya, and you can actually find that on many hiking trails. It's really common in California. It's called mugwort, Mugwort. You can grow it really simple. Like I've picked it and brought it home and just popped it in dirt, and it grows amazingly well. Very similar to like how you would dry and burn sage. You could do the same thing with a wild plant.
I'll tell you a little story about sage in my own life. I moved into the house that I'm in now many years, a couple decades ago, and there was one room in the corner, in the back corner of the house, that had a really creepy feeling to it. Every time we'd go in there, and we stored stuff in there until we got the house together. But every time we go in there, we'd say, something is weird. And we found out later that there had been some sort of a shooting or something in this room. Something had happened to somebody, something not good. So we took sage and we went in every day and burned the sage and just kind of said a prayer to get that, whatever that icky feeling was, out. And it worked. It took about 2 weeks, though. It was strong. Now, whether people want to believe that or not, I don't really care, because it was the case for my family. And we were like, we can't put a kid in this room. There's something weird in here. I don't want him sleeping in this weird shit,
Right?
Now it's my favorite room. I'm in it now, actually.
Oh, that's great.
Yeah, I'm in it now. So, and I never have that feeling about it ever. It's been, a couple of decades now. So, sage is a very cleansing of energy.
It is.
To me, it works.
If it works, it works. If it's because you believe it works, what's wrong with that? So what? If it works and it's not hurting anything, and you feel it and you believe it, that's just as good.
I've had enough experiences with it that, like, even if I've had people in my home that, either didn't sit well with me, or I just didn't want their energy in my house anymore. I was ready to, calm down, and like I always, like after parties and put things like that, we walk through the house and we burn sage, and it returns the home back to the energy that was there prior to having the visitations. I'm a skeptic, but by nature, but I try this stuff and it works. So I'm like, I'll just keep doing that. There is mystery to the universe, and that's by Western standards, that doesn't make any sense, and it's weird and it's mysterious, but it worked.
It worked. We clean not only disinfect obviously the room between patients, but we also do clear the energy, and we clear the energy from ourselves, because part of the medicine is about intention. If you don't have the proper intention or a good intention in treating somebody, their treatment might not work. It might not be good because it is a sharing of energy. You can't help it. You're in the room, you're touching somebody's body, you're putting a needle in somebody's body. And so we have all kinds of ways to clear energy. One is using rose water. We'll spray it sometimes.
I have two spots that I love getting a needle in, and one is where the third eye is, and the other is at the top of my head, sort of toward the middle back.
Right.
I don't know what those are. Well, third eye I know, but the other one. And every time I've gone for acupuncture, I go, you got to do that, because I get up when that's happening, I just feel so good.
Yes. I have many patients who love the top of the head. That particular point is probably called dew 20, which is the dew channel is a yang channel that runs also down your back along your spine. But that particular point is one of those points for stress and anxiety too, or sleep, depending on which direction you needle it. You can needle it backwards, which would be sedating, or forwards, like towards your eyes, towards the front of your face, as opposed to the back of your head, which would be more tonifying. It's also really good for your brain activity.
I like the feet, even though it hurts. Whenever I've gotten points near my toes, I'm like really like guarded about it. I'm not sure why the feet are so sensitive. Is it because of the issue that's being dealt with is why it's sensitive, or is it just a more sensitive part of the body?
Those particular points at your extremities on your feet and your hands, the more distal, further away from your core body, are just stronger points in general. But also consider the structure of the body. There's not a lot of meat on your feet, as like your stomach points. They don't hurt at all.
Not at all.
Yeah.
No. There is a prevalence of talking about gut health going on right now. I've had a lot of people on my podcast bring it up, and I've looked into it a little bit more recently, and it seems to be coming into some forms of acupuncture where a lot of the needles just go in that area because it takes it to the other parts of the body in a way. Can we talk about gut health and food?
Yeah. One of the biggest issues that we treat, that and pain, and then mental disorder or mood disorder. So gut health, there's something called SIBO, small intestine bacterial overgrowth, SIBO. And it seems like I'm seeing more and more and more people with that issue.
And how do you determine that they have bacterial overgrowth? How is that determined?
Yeah, so we can do something in what we call functional medicine, and I'll explain that in a minute, but where they would take a breath test, and we'd get the lab results, and then it would determine levels.
Ooh, I'm going to find out more about that in a second. I love that idea. Okay.
And functional medicine is really interesting, and just to touch on it, and then I'll answer your question, is really an interesting intersection of integration between East and West type of medicine, biomedicine and holistic medicine to a certain degree, because of the labs that you do and the results and the factual information that you get back from lab results. And then you take those results and you apply holistic medicine to those results. SIBO is one of those that kind of fits that intersection, as is adrenal fatigue, or like molds and things like that. On the bacterial overgrowth idea, it's very uncomfortable for people. It can keep them from eating and cause a whole lifestyle change. It's really frustrating for those that suffer from it, depending upon how severe it is. One kind of basic idea would be to take a glutamine supplement, which is easy to get. You can buy it at a health food store or supplement store or even Amazon. Glutamine is an amino acid, And taking it in a powder form, it doesn't taste bad either. You could even put it in your smoothie, about 5 milligrams 3 times a day. And sometimes that's just a quick fix that people find amazing relief from.
Oh, okay.
If it doesn't, you can stay on it and then, continue to layer with other supplements and herbs and things of that nature.
This test with the breath, what is that like? How does that? I've never even heard of this. I've heard of blood tests, I've heard of stool sample tests and urine and all that kind of stuff, but I've never heard of a breath test other than by a policeman who stops a drunk driver.
Well, it's the basic idea of the breath test, right? It's the same concept. There's all kinds of tests in functional medicine, and I'm just starting to learn more and more about functional medicine. I wasn't formally trained in it, but there are schools popping up all over. There's a couple in Arizona that are very good where you can actually get certified in it. It's a great way to just keep track of how the patient is coming along, literally like a breathalyzer test that gets sent out to a lab, right? And they test it and they look at the results and read the results back, or send it back in an email, right? So you actually can analyze it as well, but they'll give you the ranges. So then you can kind of follow along that way.
So what are you breathing into and what gets sent to the lab?
Huh.
I have to know the specifics or it'll drive me crazy.
That's funny. I haven't done a SIBO test. I haven't myself, so I can't tell you. I've done saliva tests. Like I said, I'm new to functional medicine, so I haven't done one yet.
Okay.
So I'm dying to do it as well. So I can't speak to that. But a saliva test I can speak to, and that would be more for like adrenal overload, and that's a little easier to envision, like a tube that you spit into, and that tube gets sent to a lab.
So there's a lot you could find out about a person if you just run tests in all those areas at once.
Yeah.
And you could literally see an overall picture of their entire health without any sort of invasive procedure whatsoever. You could learn about every part and organ of their body, how it was functioning.
And acupuncturists are allowed to run labs, allowed to do imaging. And now with functional medicine being so popular right now, I think it's actually gives a lot more options in how to manage your health, because now there's proof and there's real factual information that we can use.
What's the muscle testing? I've had some of that done. Is that functional medicine also?
No, muscle testing is muscle testing. So
that's kinesiology.
Yes, it is. My partner actually does muscle testing. Really what it is a mechanism where you're reading that person's body based upon, the strength of their reaction. And based upon that, you determine what supplement or what, course of action is needed. So literally, my partner would take these, 2 fingers, I'd make a circle, and she would pull on my fingers. And if they pulled apart, I would be weak in that area.
The first time I experienced this was not from a doctor. I just remembered this experience many years ago when I was in my early 20s. I went to see Dick Gregory speak at a college. Do you know who Dick Gregory is?
I don't.
He was a stand-up comedian who became a political activist. Very powerful guy. He passed away a while ago. And very intelligent, an amazing guy. And I heard him speak several times over the years. So I went to see him speak in this small room at a college. And he was talking about cigarettes and how damaging they are. And he asked for a volunteer, right? And so I got up. I was in the front, and he tried to pull my thumb and forefinger apart with his hands. And he says, "Hold it as tight as you can." So I did, and he couldn't really do it. He could sort of just maybe get a little bit. And then he put a cigarette in my mouth, unlit, not lit. He just put it in my mouth, and he pulled it apart with effortless. My hand just, and I went, "Oh my God." It was a really amazing visual message to the audience about health, because he got really into health and eating well, and as a humanistic and political statement, really, if you're going to rise to your highest level, that's a piece of it.
Yeah.
So he was an activist. He was amazing. So that moment was really powerful to me. I went, oh, there's something going on. I was young, man. I was probably 19. I was just a kid out of high school. I was like, this is like, I don't even know what this is. It was an eye-opening moment for me to realize there was other ways of looking at things than what I'd been taught.
I found it really interesting, and I could use some other words for it, but I won't. But the idea of of somebody coming in with, I don't know, 5 to 10 different pharmaceuticals that they might have been prescribed. And when you look at the list of pharmaceuticals, and then you realize, oh, these 5 they were prescribed, but then the second 5 they were prescribed because of the side effects of the first 5, something like that, right?
Right.
Yeah, and so
there's a third level: how to counteract the counteracting drug that's supposed to counteract the first problem.
and then you look at all the side effects of all these, and you're like, well, now you have to really weigh, are the side effects worth whatever it is you're fixing, right? If it's life threatening, and all that, I get it. But then I think about plant-based medicine, for example, like herbal formulas and, their roots, their leaves, their flowers, their stones, their shells, and even CBD. I'll get people who come in and they have no problem, popping an antidepressant. But then I discuss CBD, and some are like, oh, I've heard that that's addictive, or that's going to hurt me, or I'm going to get high, or, oh, I can't do that. And, and I'm just like, now, wait a second. You're on, this, and this, and these side effects. And one of the side effects of what you're taking is actually death, but you're afraid of plants. and it's kind of sometimes very baffling to me that, and I think it's just really being socialized and programmed to a certain degree, and what you're used to and your comfort level and what you've grown up with.
I once went to a friend's house for dinner. She had another friend there, and I knew the guy, and I brought my own salad dressing that I had made out of 2 or 3 simple ingredients like lemon and vinegar and oil. And he would not put it on his salad. He was afraid of it. He said, oh, no, I am not going to put that on. I'm going to use this thing from the grocery store that had, if you looked at the list of ingredients, was, thick amount of ingredients.
Mm-hmm.
And I go, how come? He goes, I just, no. It was literally, if it's not bought in a store, it isn't safe. And so afraid. I just saw the fear in his eyes. I was like, you're kidding me. And he wasn't. He wouldn't do it.
Where does that fear come from? It's really interesting, human behavior that way. I run across it in my clinic every day.
But the desperation to come to the clinic is there. If people have been so programmed to be a certain way, but it isn't working, then they have a little, they're open to something new, but they're still afraid.
Yeah.
Because they wouldn't be there if they weren't desperate on some level to try something else, because the conventional things aren't working.
And I applaud them for that, because it's probably a big step for some people. And I think
it's a huge step for people, like, okay, I'll try it, but I don't know.
Yeah. I mean, just the fact that they're there. And I've had patients who just need to sometimes just talk, and they'll literally talk for maybe 45 minutes or an hour. I'll be like, okay, we got 5 minutes for the treatment.
Being heard is a big piece of healing. A lot of times these, there's obviously diagnostic codes when you look at, your super bills from doctors, and don't take into consideration, mental aspects and psychological aspects and circumstantial life aspects. None of that. It's just, here's the code and this is the answer.
It's a business. And it's interesting, though, what you're bringing up really is bedside manner, right? And how biomedicine, I think, has changed over many, many, many years. And I think that, like, vision of a country doctor bringing, their bag to a house call and really knows the family, right? Wouldn't that be amazing? But it's a business, and sometimes you don't even see the biomedical doctor. You see the practitioner, the assistant, the whatever. But bedside manner counts, allowing somebody to be heard and really wanting to listen to them too, not just going through the motions. And that does set Eastern medicine apart to some degree, the notion of the whole body, the whole experience of that human being, as opposed to just that linear symptom. Let's say somebody comes in for sciatica pain, we can treat that pain, which would be considered more a branch idea, meaning more symptom, as opposed to the root cause. What's the root cause, right? So we'll look at it all. What's going on mentally, what's going on internally, what's going on symptomatically. And I think that sometimes gets lost in the biomedical world.
That is a really common complaint I hear from people, is the sciatic. It's one of the most common things I hear.
Yep.
Is it a mechanical issue, or is that issue caused by something else? I used to have a lot of back pain, not chronic like all the time, but my back would, quote, go out several times a year. And I got this book. I don't know if you ever heard of this guy. I've talked about him on the podcast before. His name is Dr. John Sarnow. And he wrote a book called Mind Over Back Pain and Overcoming Back Pain. And one of the things he said in the book was that the pain, when your, quote, back goes out, is far greater than what's actually going on in your back. Nothing is really, it's mentally stress induced, other than having a specific mechanical problem from like an accident or maybe a genetic issue. I don't know. But for people like me, it was going out 3-4 times a year, and I'd have to lay on my back in ice, and I couldn't, do much. And you get out of breath because the pain is so shooting. And I read this thing and I go, this can't be true. So one day I'm folding socks. You know how strenuous that can be.
Yeah.
Yeah.
Okay.
I'm folding socks. This is what I'm doing. And I'm thinking about something stressful. I don't remember what it was. And literally, as I'm folding socks, my back goes in my lower left side. And I'm like, I'm bent over. It's painful. I was down for the count for, a few days, icing. And I went, what this guy is saying is true. I thought my way into this situation because nothing happened. And so I kept reading about it. And then I started doing some strengthening exercises with core work. And I never had a problem after that. It's been decades.
Yeah.
It was an incredible wake-up call to that. Now, are there people that have genuine back issues? Absolutely. There are, I even went to a back surgeon on the recommendation of a neighbor. And he said to me, I'm looking at your x-rays, you don't need surgery. I would not ever get surgery if you're not absolutely desperate. And credit to this guy, I don't remember his name. He goes, go do some Pilates.
Oh.
And strengthen your core, and you'll never need to come back here. I did the same thing with I had a meniscus problem in my right knee, and the person I was going to, he was an alternative medicine, chiropractic and muscle testing and all kinds of stuff. She said, do the rehab you would do if you got surgery before you decide to get surgery. So she gave me some exercises to do, basically, putting your back against the wall and you're in a sitting position like a chair, and you're strengthening your thighs, and I went on a foam roller for the IT band. I did it on the outside and the inside. And that was also several decades ago, and I've never had surgery. I feel very blessed that I've had these people in my life that have given me these alternatives to avoid, things that could be lifelong issues, surgeries in particular.
Sounds like so simple, but that can actually be really difficult for people, being compliant.
I've a couple more things I want to talk about. One is, what can you tell from looking at someone's tongue? They always say, stick out your tongue. Let me see the top. Let me see the bottom. And what are you looking for?
So we're looking for the color of the tongue body, as well as what the coating of the tongue looks like. And then in addition to that, like what the tongue itself looks like. For example, a tongue that is red versus, let's say, a pale tongue means something completely different. Red has to do more with heat, and heat in the body you could think about as maybe being inflammation or pain or something like that. Whereas a pale tongue might mean somebody who's deficient, which I talked about earlier. Maybe somebody has low energy, or there's something kind of missing, or, blood circulation, something like that. Whereas the coating tells us the health of the chi in the body. The coating directly comes from the stomach. When we look at the coating, we can tell a lot about what's going on internally based upon how thick it is, what color it is. Does it look greasy? Does it look slimy? Does it look dry, sticky? Is it yellow? Is it white? That kind of idea. And we relate that coating to what we're trying to help the person. What they're, let's say they're coming in and they've got, abdominal bloating and gas or whatever. And we look at their tongue and it's red, and there's like kind of a yellowish coat that looks kind of thick and not so pleasant.
Mm-hmm. Disgusting is what you want to say. Gross. Yuck.
Maybe it looks a little gooey or slippery or something like that, or greasy. And we could relate that to what's going on with that patient. We would call it damp heat. And if you think about, what that represents, we would want to clear out the dampness, clear out the heat, and that would help them, with their stomach issues.
I was going to ask, is there a coating on the bottom too? Under the tongue? Under
the tongue, we look at the glands to see if they're engorged and what color they are. Are they purple? Are they red? Are they, inflamed, etc.? And that gives us an idea of that same concept of excess and deficiency. And then, like, for example, if you have a scalloped tongue, like you can see the teeth marks, that could indicate a deficiency, like a weakness, and like maybe overthinking, or someone who's tired or fatigued, or someone who's just not getting enough rest or proper nourishment.
The last thing I want to talk about, I think it's the last thing. I don't know. I want to talk about food. I want to talk, because you had mentioned plant-based diet. I want to start with something that's has been a challenge for someone that I know. She says that she has to eat meat because she doesn't feel well when she eats only plant-based, because she doesn't get enough vitamin B. You look like you're really thinking about that one. And the other part is, are there, I've heard about blood types that are better suited to eating meat. I've heard about historical family kind of genetics, people coming from being meat eaters. I don't eat red meat. I've never really liked it. Even as a kid, I didn't like it very much. It kind of made me feel like heavy and not good. So I don't eat that, but I do eat, chicken and turkey and fish. And I feel better when I eat that than when I don't. I have a little bit more energy. And admittedly, I haven't studied a plant-based diet, but it seems, and I know there's athletes that do it and people love it. Let's talk about that. What are the options that people have? And, are you strictly that yourself? How does someone, if they want to sort of explore that, navigate that that change?
There is this notion that vegetarians, vegans don't get enough protein
Yeah.
because they don't eat meat. But remember, protein is in vegetables, is in fruits, is in nuts, is in grain. It's a different kind of protein. And you don't necessarily need animal protein to survive, but you need protein. It depends upon what you're comfortable with. What you're comfortable with in eating fish and chicken, but not red meat, that's your comfort level. And everybody is so incredibly different. A plant-based diet might not be for everyone, but I will ask this of people to explore. The idea of where your food comes from, the source of your food, to me is almost more important. Where's it coming from? Know where it's coming from. When you go to a mainstream grocery store and you buy packaged meat, where'd that come from? How many different cows did that come from? What processing plant? What was the mechanism by which that animal, provided that package of meat? That's really important, not just energetically, but also, like, if you think about the nutrients and the vitamins you're getting from it. If someone is really interested in a plant-based diet and going vegan, I would say there's a book called Healing with Whole Foods, and I think the author is Pitchford, maybe Paul Pitchford, Healing with Whole Foods, and it's a great place to start. It gives you recipes, it gives you nutrition, it talks in layman's terms, not just medical terms, about food and how your body uses food, and all this amazing information. And as far as blood work, I do think there's something to that. I haven't really read the science behind it, but I will say I do think people, let's say type O versus some other type of blood, might be more attracted to meat versus not. But I also think that it might be cultural to a certain degree. Also, let's be real about this. Chicken and turkey and birds are meat. So when somebody says, I don't eat meat, and then they say, oh, but I eat chicken, you eat meat.
it's definitely meat. it's bird meat.
Bird meat. Exactly.
Yeah, sure. No, I don't eat red meat is what I say.
I would also maybe suggest that, moving towards more fish for that omega-3 kind of level diet that is so helpful as we age.
I like all that. Yeah, I'm open to trying new things. I just, have experimented over the years, and I probably didn't do the vegetarian thing particularly correctly.
I started by deciding I'm not going to eat anything from a cow, butter, milk, etc., cheese, and I stopped eating everything from a cow, and then it just kind of trickled from there.
Okay, so you started slowly, and then you felt better, and you kept going.
Yeah.
Yeah. So, I know a lot of people, they try to, change their diets, and it bothers their stomach to eat like raw salads right away and not be able to handle that. So I've had a couple people tell me that I just can't, it doesn't feel good. Plus, it just seems like, I don't know why I'm looking out the window now. It seems like the part of the issue, part of the obstacle is the effort. The education and the mindfulness to find the correct products. The expense can be greater, buying organic and seeking it out. It's more work in some ways than the convenience of getting in the car and going to the grocery store. And I think that is an obstacle for people, especially when they're busy. They don't want to do it. You can pull into the gas station, get some cheese crackers, and you're on your way.
Right? You can, especially on those road trips.
How do people find you if they want to locate you? Is there a website? How do you want to promote what you do? Because it's awesome.
Thank you. Yeah, I have a clinic in Marina Del Rey area on Washington Boulevard. I have a website. Sheri Jennings Acupuncture, and my name is Sheri, one R and an I. I'm on Yelp if people want to look at me on Yelp. My practice is really easy to find.
Well, thank you so much for doing the podcast, and I hope that we've illuminated some areas you have for me, and I hope the listeners have enjoyed what you have to offer.
Good. I hope so too.
Thanks so much.
Thanks for having me.
Well, thanks for listening in to The Exploding Human. Glad you made it. And check out my website, theexplodinghuman.com, and subscribe to my YouTube channel, which is The Exploding Human with Bob Nickman. Add the with Bob Nickman. And don't forget, Hero Soap Company has the best soaps. I want you to go to that website, check it out, order some soap. You will not regret it. That stuff smells so good, so refreshing. Got the essential oils in it, and it lasts a really long time, which is something I didn't realize was going to happen when I got this soap. And if you type in the word exploding at checkout, you will get a discount. And these guys over at Hero Soap Company, because they're veterans, they donate a portion of their profits to support homeless vets. So not only is it a great product, it's a great cause. So check them out, Hero Soap Company. I want to thank you guys for listening in. Have a great day. Bye.